there is lot of difference between these generic name, but the brand name or its sounding is similar. So it's harmful to the patients when the dispenser dispense the different brand to the patient. Another is microdox. Microdox is doxycycline and microflox is a ciprofloxacin. Fifth class is Lassa drug. Same drug, different dosage form. This is the category. Like Cefadrox, dry syrup. It's contains cefadroxil. Cefadrox 500. It's a cefadroxil capsules. Cefadroxil tablet. Cefadroxil dispersible tablets. Cefadrox P, that is, it contains 125 mg. So, whenever the prescriber dispenses these medicine, he must be right. It is syrup, it is capsule, it is dispersible tablet, it is 500 mg dose. Because, example, if we take a kids who is suffering from some disease and doctor prescribes cefadroxil, but the dispenser dispense the tablet or capsule instead of syrup, what would be happen with all the treatments. Sixth class is same drug with different release characteristic. Like there is Voveron. Voveron is diclofenac and Voveron SR. SR is sustained release tablet. So SR is sustained release. If a sustained release drug is prescribed and instead of conventional tablet is administered, so the pharmacist should be check before dispensing the drug. He dispense sustained release tablet or he dispense the conventional drug therapy to the patient. Another is sixth class is Lassa drug. Same drug, different release characteristic. So example is Arflox, ofloxacin, same drug with different release characteristic, that is Arflox, ofloxacin, Arflox DT, means dispersible tablet. Seventh class is Lassa drug, same brand name, different composition in different countries. Like Megadox. Megadox is doxycycline, is used in Nepal. And Megadox is acyclophenate used in India. If one doctor shift from Nepal to India and he prescribed the Megadox and our pharmacist given the acyclophenate instead of doxycycline, there is no use for the patient. Example again is Milol. Milol is acyclophenate. Milol is atenolol and amlodipine combination used in India, but in other countries it is metoprolol. It is again confusion in different countries having same brand name but different composition. Another is Lassa drug, generic drug pairs like folic acid, folinic acid, cetirizine, steralin, nifedipine, nimodipine, fentanyl, sufentanil, ephedrine, epinephrine. So these are the different categories that have Lassa drugs and error-prone drug pair. The conceptual framework to reduce the error. One is drug product inserted into complex care environment. Drug product interact with care environment and care process in indefinite, identifiable and predictable fashions. These interactions will be determined by specific product characteristics and specific care process. Error occur in predictable ways. One is allow risk assessment. Another is allow risk reduction. And third is allow error prevention. Risk for error and ADE. One is error producing conditions. Second, likelihood of error occurring. Third is environment and process of care. Fourth is drug involved. Fifth is patient characteristic. And sixth is nature and type of errors. Any or all characteristics of a drug product can increase or decrease risk and must be considered in risk assessment. One is generic name or brand name, dose, strength, dose form and packing. Third is route, frequency and instruction, storage requirement, indication, patient populations, likely care environment and others. So drug product, error, the medical care vortex. Implications for risk reductions and safety enhancement. One is predictable natures of error allow risk assessment and reductions. Second is predictable natures of error allow product design which can enhance safety. Third is all drug product characteristics must be considered in risk assessment and prevention. Fourth is care environment and process must be considered in risk assessment and prevention. So, drug name, label and packing are the major contributor to the medication error. Risk for error is determined by both drug product characteristics and the care system process. Risk assessment must include multiple drug characteristics. Risk of error within care system often readily apparent. The predictable natures of error provide opportunity for product naming and design which reduce risk and enhance safety. The possible solutions. Now, first is identification of LASA medication. Create the awareness of look-alike and sound-alike medicines in the prescribers. If possible, provide a detailed list of the drug name pair in the local market. Second is prescriber role. Try to use legible handwriting while prescribing, keeping in mind as if one was written blank check. Writing trade names accompanied by the generic name, dosage form, strength, direction and indication for use when possible. Now, pharmacist and dispensers role. Pharmacist and dispensers that provided that there is done and other detail in the prescription. She should make use of her knowledge to identify the drug prescribed. In case of uncertainty in medicine's name, they should not hesitate to consult the prescribing doctors before dispensing. Like example for this, if doctor have written some drug is 2 mg to the patient, but as per pharmacist knowledge, the minimum dose is 0.2 mg. By mistake, doctor have not mentioned the dot on the prescription, but pharmacist have knowledge like doctor have not mentioned, and he should consult with the doctor. Doctor, is this 2 mg given to the patient or it is 0.2 mg given to the patient? Maybe doctor is appreciate to you because due to the heavy rush, doctor is not considered and he has mentioned 2 mg. So this is the moral duty for the pharmacist also whenever he dispenses the drug. Now, patient role. Literature patients can themselves check if the dispensed product is the same as prescribed. Patient who cannot read or write should better consult other sources for verification before taking the medicine. He should consult with the pharmacist when he take the medicine. It is BD, it is HS, it is at bedtime or it is OD. So pharmacist has duty to educate the patient whenever he take the medicines. Hospital or institution role. Hospital and institutional provide education on potential LASA medicine. Continuing professional development for healthcare professions and annually review the list of LASA medicines used in the institution. Try and reduce the medical transcriptions by the nursing staff and rather initiate dispensing only against a proper prescription by a licensed doctor. Use of printed order or electronic prescribing, the less important drugs in the Lassa pair can be removed. Now, manufacturers and regulatory agencies role. The manufacturers and regulatory agencies both should work together hand in hand to avoid confusion right at the time of naming their products. Predictable problems. Insulin brand name. In Humulin, hum insulin order instead of Humulin L-Lente. Nasib thought Humalog was to be given due to the handwritings, the insulin given, wrongly insulin given to the patient. Names and label. We know Novolog, there is mentioned R. Now Novolog is regular insulin, or R stands for tribe, or R is rDNA origins. That is the problems for the pharmacist to dispense whenever he dispenses the Novolog. Oxycontin, MS-Contin. So the dosage form. According to the handwriting, patient prescribed the different dose to the patient due to illegible handwriting of the prescription. Another example is Xanax XR, that is alprazolam extended release tablet. So in this, the generic name is not readable by the pharmacist or the patient or dispenser whenever he dispenses the medicines. Even though the doses, like doctor have prescribed the 200 mg and the pharmacist given the 300 mg with the same brand name, and there is no differentiate between the look like to the doses particular drug. Eligibility and drug naming. So here doctor have write Unacin or vancomycin, that is not readable, or if a doctor have written the Protenex or some their generic name is written as a highlighters. So that is the confusion to the patient, to the pharmacist also to dispense the medicines. Why dose, route, frequency and indications are important. In one prescription, try co for traces. So error is determined the dosage was different. One is Prosacar in females, the dosage error not detected because dose was the same. Again there is mentioned POOD, there is also mentioned per oral bis and diet, so that causes the problem to the patient and pharmacist. If pharmacist dispense and tell to the patients about the doses, there are two doses are written on the same prescription. So here is the example for different Lassa drug, Enzyte, metronidazole.